with the first question. So the first question, I will ask each of the panelists for 5 minutes opening statement. It can be shorter if you wish. Opening statement on where are we heading during the with the current policies. What's the state of the pandemic right now? What do you think? This can be quite open-ended, and I would like to ask Professor Bar-Yam to start the discussion. Professor Bayam.
Thank you very much. So we are now in a stage of the pandemic where there has been tremendous improvement in the situation. In particular, in Poland, we see a dramatic reduction in number of cases of transmission. And there is a tendency to believe that this is an indication that we can celebrate the ending of the pandemic. Unfortunately, we've seen before that a reduction in transmission is not the end. There is an exit for the pandemic, which is to stop transmission completely, i.e. the achieving of elimination. And the question really in front of us is whether we will target and intentionally go for that exit. What we've seen is in countries that have set that as the objective, that they have been successful in not only reducing dramatically the impact on health and economic activities, but have been able to sustain the advantages of elimination for extended periods of time. Over a year of time, they have had very minimal disruptions of their social activities domestically. The price that they have paid is a limitation on travel. And this has been an impediment to many countries in Europe achieving the same goal. And so one of the key points that I want to make is that it is possible to use feasible travel restrictions with the tremendous power that is now available from vaccination to achieve elimination locally and to sustain the low number of cases. And the imperative for doing so is not solely due to the ability to sustain local life in the face of the current conditions, but also to prevent new variants that have been able to dramatically accelerate transmission and to result in more severe cases, more frequently severe cases, and are showing the ability to undermine the effectiveness of vaccination, which is a tremendously powerful tool that we have to decrease transmission without resorting to the same level of social restrictions and economic limitations that was necessary earlier in the pandemic. So the basic framework is the following. We now have a virus that is at bay, so to speak. We've been able to dramatically improve our situation. But if we don't finish it off, if we don't act to stop the outbreak locally, we will be faced with ongoing cases, ongoing hospitalizations, ongoing conditions that are both detrimental to health and to economic activity. On the other hand, if we intentionally take this opportunity to stop transmission, we will be in a position to be secure in the health of the people and in the restoration of economic activity. And in order to do so, we have to find ways to both limit but also to make safe travel. And it's important to mention that it is known that we can allow commuters, whether they're international commuters or commuters from domestic location to domestic location, and to continue to sustain an elimination strategy. The key to the elimination strategy is both to be very close to or at zero transmission cases in the community, but also to have the capacity to respond rapidly and aggressively to any small outbreaks that occur. We also have to pay attention to the pressures that are being placed on eliminating international travel restrictions. And this is a very important issue to address. Where such travel is counter, and it is counter to maintaining internal controls over transmission, it is possible to set up mechanisms by which those travelers who come into the country are limited in the domain of their activities to resorts or to other locations, so that they are not able to infect the population at large. And using such mechanisms, one can prevent the consequences that are associated with importing both conventional variants, or the original variants, the second generation variants, the third generation variants, and of course the Delta variant that's now, and future variants that will be, that may very well have more significant consequences. Let me finish my initial remarks there, and I'll be happy to answer questions.
Thank you very much. Dr. Jeremy Rossman.
Thank you. So right now, we are currently at a much better state in many countries than we have been previously over the course of the pandemic. But unfortunately, this has come through a dependency on vaccines. Now, vaccines and the COVID-19 vaccines have been one of the most powerful tools that have developed in our ability to control the spread of the virus and to protect people's health. And we are seeing the benefits of that right now in terms of reduced case numbers, reduced hospitalizations, and reduced fatalities in countries around the world. This is a very effective tool that has been used well, and we are starting to see very good levels of vaccination in many countries. But unfortunately, this is giving the perception that, in fact, the pandemic is over or is in hand. And that is not true. That is not where we are at. In many countries, we still have fairly low vaccination rates in terms of people that are fully protected, that have had 2 doses and are protected against even some of the newer variants of the virus. We also have very high levels of community transmission in many areas and in many countries around the world. And we have the continuous evolution.
I'm sorry, I don't want to interrupt you, but can you speak louder or manipulate?
Closer to the microphone, perhaps. Thank you.
Certainly. How is this? Okay, I will begin again then. So we are at a much better state in the pandemic than we have been previously. We have very good vaccines that are doing a very good job at protecting people from infection, at protecting people from hospitalization, and at stopping COVID fatalities. This is working very well in many countries around the world. But unfortunately, this is giving the perception that, in fact, the pandemic is in hand and that we can start relaxing and easing restrictions. Now, we are in a much better state than we have been previously. But unfortunately, we are also in a state that is dependent on the vaccines for the protection that we are seeing. And again, the vaccines are a very powerful tool, but we are also still in a state where there is high level of virus present around the world. There is high level of community transmission that is occurring in many countries around the world. And we are also seeing the continuous evolution of the virus, where every time a new person is infected, the virus changes a little bit, and we are starting to get new variants emerging that are starting to either transmit better, potentially increase severity of cases, and can start to evade the immune system. So we are in a better position, but what we need to be doing is focusing on supporting the vaccines with public health measures instead of solely relying on the vaccines. And this is where we need to focus on this idea of an elimination strategy instead of just a mitigation strategy. Because sole reliance on the vaccines can be very good at mitigating and reducing virus transmission. But if we actually eliminate virus transmission, and this is the idea of a zero COVID strategy, then we allow the vaccines to work. We protect what we have gained with the vaccines.
Będzie lekki szok.
Protect people's health.
No, klimatyzacja ma dobrą, tylko chwilę trwa, no. Otworzę okno.
Prosimy o wyciszenie, przepraszam.
Let's continue, Jeremy.
Okay, so why then have we not pursued an elimination strategy? And the reason for this is that, first of all, there's the perception that elimination is not possible. But in fact, as we just heard, elimination is possible, and we have seen multiple countries that have eliminated local transmission of the virus. And what we have from that data is we know that elimination is a very beneficial strategy, not only for protecting people's health, but for protecting economy and civil liberties. There's been a recent report published in The Lancet that has shown that countries that have focused on an elimination strategy, and this includes use of the vaccines, have had better outcomes in terms of people's health, in terms of the economy of the country, and in terms of protecting people's civil liberties. So these strategies are effective, these strategies work, and we have the data now during the course of the pandemic to show that they work broadly across society. But importantly, we still need these elimination strategies because we still have significant portions of the population that are not fully vaccinated, that are at risk of severe COVID disease. And this includes children. We still have significant portions of the population that are at risk of long COVID and protracted symptoms that can really cause significant disability over the long time. And of course, we still globally are at risk of continued virus evolution, of new variants that can pose risks to the gains that we have gotten through our vaccination campaigns, because we are already seeing variants such as the Delta variant that can start to evade the protection that the vaccines offer. So what happens with the Epsilon variant? What happens with the next variants that start to evade the immune system more or start to transmit even further? This is why we are advocating for an elimination and a zero COVID strategy, to protect the gains that we have and really allow us to look into the future for a real exit strategy. Thank you.
Thank you very much. Dr. Gasperowicz.
Good afternoon. I would like to present a couple of slides. So one thing that we need really to understand is that the COVID spread dynamics, that it spreads like it's similar to such a phenomena like melanoma cancer, cancer mice infestation, or wildfire, in the way that if you have just a little bit of it, you're still in huge danger. So like in wildfire, if you have a campfire and don't put it down completely and it's dry, just few embers can start a wild, uncontrollable forest fire. And that's exactly what we've seen in around the world after the first wave last summer. That's the example from Alberta in Canada. We had the first wave, then we reopened at 10 daily cases, and then COVID started to grow. It grew very slowly, but persistently through the whole summer. And then after opening the schools, it exploded into the second wave. And basically the same pattern happened all over Europe. It was in Austria, in Switzerland, in Czech Republic, almost everywhere the same pattern. Small number of cases, too early reopening, not at zero, but at small number of cases. Cases were growing and then exploding into the second wave. In contrast to this, countries that went for elimination, for example, like regions that went for elimination, for example, Victoria, Australia, they had a wave and then they decided that they won't reopen until the community spread is at zero. So they kept the restrictions till they got to zero, then they reopened and they had normal life for many, many months. Other countries, and they didn't have another wave. So other countries that did similar strategy, so elimination strategy, were New Zealand, Vietnam, Taiwan, Atlantic Canada and territories, and many others. And they all succeeded. In Canada, we have interesting situation because some regions opted for elimination and some for mitigation strategy. And the differences are really striking. So this is an example of, so this graph shows daily new cases per 100,000 people. The gray areas, the gray lines are mitigation provinces, and the colorful ones are Atlantic Canada, so four provinces that went for elimination. And as we can see, there's so much less cases in elimination provinces. And what they did is they closed themselves, they made a lockdown, they limited travel, they went down to zero, so they eliminated local transmission. Only then they loosened the restrictions within each of the province. And then they, for an interesting thing, they formed an Atlantic bubble. So they opened to themselves. So all these four provinces joined together. They didn't have any more travel restrictions between themselves, but people coming from outside those provinces had to quarantine for 14 days. And also not everybody. So people who had to travel frequently, like essential workers, didn't have to quarantine, yet the zero COVID status was preserved. So some allowances are possible in those travel restrictions. And they were basically COVID-free for many months. They were those little spikes are imported cases. Then they had little outbreaks, but they were all contained. Even the largest recent one in Nova Scotia was contained with few weeks long lockdown. And what is important here is that this outbreak here didn't spread to other zero COVID provinces. So those regions are protected. And it's in a big contrast with all the rest of Canada that had huge waves with very strict lockdowns. And that's what Dr. Rossman already mentioned, the recent publication in Lancet that analyzed countries that went for elimination, compared it with countries that went for mitigation. And in various metrics, the elimination countries fared much better. So of course, they had much less deaths, they had better GDP, less GDP decrease, and even some positive increase in GDP in 2021. And also what is interesting, that overall strictness of lockdowns was much smaller in elimination countries than mitigation countries. So actually we have much worse life in countries that went for mitigation. This graph shows, so the question is now, why bother about elimination if we have vaccines? Can vaccines get us out of the pandemic just by themselves? And basically the answer is no. So this graph shows it's a model for the wild type, so original strain of COVID, the old COVID that we had last year. We've seen all over the world that public health measures, so various strength of lockdowns, were able to reduce the number of cases with halving time from 6 to 12 days. So basically, if you would keep this halving time of 8 days, then starting from 100 daily new cases, you would stop transmission in just 8 weeks. Then, if we have vaccines, and vaccines would be super efficient, and 80% of eligible population would be vaccinated, then we would end up with R value just below 1 and halving time of 87 days. So what I want to show here is that basically lockdowns are more efficient in reducing quickly reducing the number of cases than the most efficient vaccines. But then when you add both vaccines and public health measures, you can result in like really super fast decrease of cases. So basically, if last year we would have vaccines that we have now, we could end pandemics in 2 weeks, and it would be great. But during this year, we let COVID spread and we let it mutate. So it generated a variant that is the Delta variant, which is twice more transmissible than original variant. And what it means that the same level of public health measures that a year ago could like reduce cases, halving them every 8 days, now with a variant that is twice more transmissible, it won't bend the curve. The variant, if we would have only public health measures like this, then the variant would still grow. With vaccines, if we vaccinate 80% of eligible population with vaccine that is 99% efficient against transmission, and we open everything and we have Delta variant, then it will be still doubling every 4 days. So basically, with Delta, we are not able to stop Delta growth with vaccines only. But fortunately, we have vaccines and public health measures. If we use both of them, even if we vaccinate just 70% of eligible population with vaccine that is just 90% efficient, then, and use moderate public health measures, moderate lockdown, then we can achieve halving of 6 days and stop the spread of Delta variant in 6 weeks when we start from 100 cases. So basically what we did during last year, we weakened our weapons. So we had a great weapon of public health measures, great weapon of vaccines, and we made them much, much weaker. Fortunately, we still can combine them and still win with the virus. But the problem is if we let virus spread and mutate more, and if this R0 will get to, for example, 12, then we will be in really big trouble, because then we would need, like, I don't know how strong vaccines and even much, much stronger health measures to bend the curve. So it's imperative that we stop it, that we eliminate the virus. And the most important is also that we don't let Delta variant grow. And fortunately now in Poland, we are in very good situation. So, and I did this calculation last night and was really surprised with the results, that halving time is less than 8 days. So the daily cases are going rapidly down. And it's probably thanks to public health measures and that we have so much vaccinations on top of it. So if we would not reopen too much and just continue what we are doing, in less than 2 months, we can be at 0. If we would make the measures a notch stricter, so get to 6 days of halving time, then Poland could be at 0 COVID cases on August 3rd. And then with vaccines, it's easier to maintain the 0 status, because even if vaccines alone cannot stop the spread, but they sort of make the wood less dry. So even if some sparks of imported cases will come, they cannot catch on so quickly. So that's why I think it's really important that we go for 0. And yeah, so there are ways how to get there. So explicit goal of COVID elimination is essential. Mandatory quarantine of international and interregional travelers, temporary shutting down of all non-essential activities, which could take like 6 to 8 weeks, and then that could be over. And essential is financial support for businesses, individuals, and vulnerable populations, because people cannot survive on their own without any support for 2 months. Preventing airborne transmission is very important. Aggressive testing, tracing, and isolating. Smart vaccination, so vaccinating people who transmit the most as first ones. And once there is no new community cases, regions can start to reopen and form bubbles with each other. So as of today, around 2 billion people live in regions with little or no COVID, so it's around 30 countries. And it would be great to join them. Thank you very much.
Thank you very much. Professor Scully.
Thank you, and thank you for the invitation to speak with you today. I work in the United Kingdom, and I'm Irish myself, so I also work in Ireland. And I think we are in a very interesting position at the present time in the UK, with a very high rate of vaccination. It's 81% of adults have had a first dose, and 59% of adults have had 2 doses. And that has had an enormous effect, an enormously beneficial effect. And the numbers of cases, the numbers of hospitalizations, and the number of deaths have dropped dramatically. Unfortunately, however, they've started to increase again. And we're now, despite that high level of vaccination, entering what all of the models predict will be a 3rd wave. The different models predict different heights to that wave and different duration, but they all predict that we are going to have a 3rd wave. And at the moment, cases and hospitalizations are increasing between 30 or 40% per week. And this is obviously a very serious problem, and has led to a situation where some of the restrictions we've had in place that were supposed to be lifted have not now been lifted. And there is only one reason for this, and that is the arrival of the Delta variant on the shores of the UK. And the reason why it has caused such problems in the UK and not elsewhere in Europe yet is because there was an open borders policy for flights from the countries where that variant was very dominant, and a huge number of people came in. And there was a most interesting contest between the variant, the Delta variant, and the Alpha variant. The Alpha variant being the one that originally was identified in the UK, and the new Delta variant, which was originally identified in India. And it was a struggle between the two for dominance. And the Delta variant, because it is much, much more transmissible, somewhere between 40 and 80% more transmissible, has easily won that battle. And it's this new variant that is driving this third wave. Now, that doesn't mean that vaccination isn't going to win out, but it's going to be a close run thing over the next couple of months. So this is causing a great deal of thought about why we are in this position now when vaccines were meant to be the solution. And the reason why is because vaccines are not the full solution. Vaccines are extraordinarily important. They are the most important tool we have, but by themselves, they will not succeed. They'll not succeed for 2 reasons. Firstly, in the UK, there's not been a decision yet to vaccinate children and young people under the age of 18. And secondly, there is wide variation in the uptake of the vaccine between different social groups. And this causes particular problems because some of those social groups, people who are unemployed, people who are in overcrowded housing, people whose language skills are poor, are congregated in certain areas, in some local areas. And that means that there is a real possibility and a real existence of outbreaks in those areas that then seed cases to surrounding areas. And that's how the virus is spreading. So although vaccination is very good, it requires that really detailed work to work with local communities and local community leaders and with local public health teams to get vaccination to be successful. The second reason is, of course, this issue of variants. And given that it is going to take 2 years for the world to become fully vaccinated at the best estimate, unless the patent waiver goes ahead, there are going to be cases all the time across the world. And that means there will be new variants appearing across the world. And we have these 2 examples. One, the variant which arose in South Africa, which has an ability to avoid the immunity granted by one of the vaccines, the AstraZeneca vaccine, and that vaccine is still not used in South Africa for that purpose. This South African variant is not affected by the vaccine to anything like a satisfactory degree. And then the second issue is transmissibility. And what we've not yet seen is a variant arise which has a very high transmissibility, like the Delta variant, plus an ability to avoid the immunity granted by vaccination. And that is the worst case scenario. So our guard against that is a global effort, and all countries should be participating in this global effort and fully supporting it to achieve a worldwide vaccination. Also, it requires an ability to stop quick movement of variant across the world, and that is something that has been a struggle for many countries, and those countries that have managed to do it and do it properly have done extremely well. The second really important thing is that we have lots of other measures in place. So our strategy must be a vaccine plus strategy. With vaccination, we need to get good coverage in our own countries. We need to consider really seriously the vaccination of young people, as is happening in the United States now. The virus is becoming so transmissible that we require really high levels of vaccination in order to keep it under control. And it looks very much as if to achieve those very high levels, it will be necessary to vaccinate children and young people to some extent. The plus measures are very clear as well. We need to work for elimination. There is sometimes a misunderstanding of the word elimination, and public health people and epidemiologists tend to use it without ever explaining it, but it's important people understand. It doesn't mean that you have no cases. It doesn't mean that you've got no cases, and if you have a case, it's a failure. Absolutely not. Much of the world has eliminated diseases, but still has cases. And countries work very hard to eliminate dangerous diseases. And I know of no other dangerous infectious diseases affecting Western countries that we don't try and suppress completely. And the good example is measles, a highly transmissible disease. We put large amounts of effort into eliminating measles in our countries. The UK has had a time when there was measles was eliminated, which meant that there was no internal transmission. When you had a case arising in the community and you had an outbreak around it, it was dealt with rapidly and effectively. So there were cases, and still are cases from time to time, but it didn't spread widely in the community. But the UK has lost that status because over the last couple of years, our vaccination levels fell and measles was able to reestablish itself. So elimination means having the virus absolutely under control. It doesn't mean that and having the ability to suppress it doesn't mean that you never have a case, but you have got the systems in place to deal with it. So the public health systems, finding, testing, tracing, isolating, and supporting people during the course of handling these outbreaks or flare-ups is extraordinarily important, and we need to strengthen those. It has to be locally based and locally resourced and locally connected to communities. We need to stop imports, which I've already mentioned, and we need to also take some of the key preventative measures. One of the big things that's changed during the course of this pandemic is our understanding of how it is spread. At the beginning of the pandemic, all the emphasis was on droplet spread, which is why we haven't had as much effort into key issues like ventilation as we now know we should have. We now know it is spread by air, and ventilation is extraordinarily important. And we need to move to that as an absolutely universal mitigation procedure. And in many ways, it's just rediscovering what we knew in Europe 100 years ago, that things like good ventilation, fresh air, sunlight were really important for all our health. And that's what we've got to rediscover and make sure that all workplaces, all places of learning, all places that people congregate have good ventilation and are kept safe. So my advice on this and to deal with the problems we're having is vaccines plus. Thank you very much.
Thank you very much, Professor Scully, and thank you all for your opening remarks. And I think a lot of doubts have been addressed, but still we do have this non-expert question coming up again and again and again. Professor Scully has touched on the importance of open borders. Professor Bar-Yam also said about the travel restrictions we need to have, and we have an idea of how to have achievable travel restrictions. Also, Dr. Gasperovich mentioned the travel bubbles that can be between the different elimination green zones that can help facilitate. The often asked question is, well, even if we go near zero, is it really doable in the global world? Is it really possible to go to zero? Somebody flies in, and then we have the problem all over again. So just to put it into the framework of Europe patient proposal, we say let's have supplementary income so people stay home, be socially disciplined, and for 6 weeks, let's have no travel. Let's have people stay at home. What would happen then if we implemented this measure Europe-wide for 6 weeks? What do we expect happen, and what would happen if we do not take this measure in the future with this Delta variant and so on? And maybe this time, if we could start with Dr. Gasperowicz.
So if we implement the measures at the same time in every country, this 6 weeks, 8 weeks of as strict lockdown as possible and travel restrictions, then all these countries basically can go. Also, if we do it, we divide regions to even smaller regions, then all these regions can go to zero and can eliminate locally the virus. So then the ones that achieve the green zone or achieve the zero status can join and travel freely between each other. The ones that would lack a little bit and need more time to eliminate can wait with joining, but then they won't hinder, they won't slow down normal life in the regions that already achieved zero.
Professor Bayam, you mentioned travel restrictions that could be achievable and doable. What did you mean?
So the main thing that we've been talking about is the opportunity to progressively achieve elimination from local communities all the way up to, in this case, Europe as a whole, which would tremendously enable the internal travel. And then the need for restrictions internationally, not international, intercontinentally, if you will, can be very bounded to those places that continue to have transmission at a level that cannot be controlled. But the point is that if we do limited travel restrictions in such a way, for example, to allow commuters, essential commuters, to travel, we can still control locally the outbreak, and it doesn't take very long. So we're only talking about a period of a few weeks. And during a period of a few weeks, progressively more and more regions achieve elimination. They become green zones and are connected to each other by allowed travel. And it's hard to imagine right now, with this pandemic being around for a year and a half, that it would only take a few weeks to achieve a Europe-wide elimination situation where not only normal social and economic activities could take place, but all of the internal travel could be completely unrestricted. And to realize that this only takes a few weeks may be surprising, but the reason for that is that we can use it as a ratchet process, as a process that progressively builds on previous accomplishments. And because the time frame is only on the order of weeks, each region that achieves elimination can then go back to more and more normal activities very quickly. And it rewards those who achieve it early, but even the ones that take a longer time, as Gabriel said, only take another couple of weeks, and then it can expand to fill the entire area that is engaged in this effort, and in this case, all of Europe.
If Professor Scully or Dr. Rossman, do you want to comment on the travel? So let me maybe move to the next question, because it often is claimed that even if countries have go for close to elimination strategies, then they still might have some spikes in cases later. This is the argument. Well, and we look at the previous data, right? But now we have this Delta variant, and I wanted to ask you if this, what would be the benefit of having this zero COVID approach, even if it is not completely elimination going to real zero, even if we don't achieve what we aim for, which is complete zero in Europe and then later in the world. How would the picture be different, considering the Delta variant spread and the dynamics that we see? Maybe let's start with Professor Scully.
Yes, I think we have to recognize that we are going to have outbreaks and flare-ups. There's not a country in the world that doesn't detect cases of COVID-19. The difference for many of the countries that are at zero is that they manage to detect them in quarantine arrangements on their borders, and they manage to deal with them that way. But even then, countries that have been zero for a long time are getting some cases in their communities, but they've shown, and we've learned a lot about how rapid response measures can deal with that. So the importance is that we don't have waves. It's the waves that drown people. It's the waves that drown society and cause the economic damage. It's the waves that drown our health services. Ripples we can cope with. And that's what we must learn to be able to respond to, ripples of cases appearing. And we need to have our systems, all of our systems in place. We need to have our genomic sequencing in place across the world to be able to warn us, give us early warning, and to detect spread and plot and map spread. We are going to be playing cat and mouse with this virus for some time. But we can do it, but we can only do it. And I mean, I spent 40 years working on public health in England and in Ireland. And that's what public health systems are for. They are to be there to deal with upsurges and outbreaks of communicable disease. And we must treat COVID-19 with the seriousness it deserves and not think that there is any way we can live with this. We can die with COVID-19, living with COVID-19 without this very rapid and strong response is not going to be at all a good scenario.
Dr. Rossman, any final word on this?
Yes, thank you. So there's clearly going to be increasing spikes of cases, even if you get to an elimination point. With virus still very prevalent around the world, there's no way to prevent against some introduced cases. But the point is, if you are able to eliminate virus transmission locally, and then create and make sure that you have maintained the infrastructure in place in the country to respond, then you are simply investigating and responding to hotspots and small outbreaks. And this is, again, as we just heard, this is something that countries have done for years. This is what we do to outbreaks of measles virus. We have very good systems in place and a long track record in being able to identify cases of infectious diseases and respond to them locally. But the important point here is that we don't want to use just one tool. We don't want to rely only on the vaccines, but we also don't want to only rely on a lockdown strategy. We have a lot of tools, from testing to contact tracing to supported lockdowns to vaccines. We need to use all the tools at our disposal to create a robust system that reduces and eliminates COVID cases locally now, but then is able to maintain that and have responses to outbreaks instead of being crushed under the wave of cases.
Thank you very much. We have 3 minutes left. Do we have any question from the audience? If not, I would ask the panelists if any panelists want to have some final word. But okay, Professor Bayam.
I think part of the point that is really important to recognize is that there really is an exit from this pandemic. We continually are seeing that people are accepting very terrible conditions that have recurred over a long period of time, that were unexpected at the beginning, except for a few people who understood that this was a much more severe circumstance than people understood. But now that we've experienced this, people are now accepting it. And this is not necessary. We really can be successful at exiting from this pandemic, but we have to make the decision to put our efforts into doing so. And that exit will tremendously improve both the lives and the economies of our countries. It doesn't take all that long, but it does require a decision to do so.
Thank you very much. Any last minute comment or question from the audience or from the panelists? I don't see any raised hands. Alec?
No, I think it was very intensive, and we have to work on that in our heads now.
That's right. Thank you to all the panelists. I think this was a wonderful, knowledge-packed, but really brilliantly synthetic panel. Let's have a virtual round of applause to all our panelists. Thank you all for your time, for making it to our time zone, and let's hope we will be in touch. I will stop the recording now.